Hi guys, Sarah Tessner here. Just wanted to talk to you today about the process of embalming. The definition of embalming is to chemically treat a deceased individual to promote disinfection, temporary preservation, and also restoration to a more natural appearance. Disinfection means to inhibit the growth of or reduce the number of microorganisms that could possibly cause disease within living individuals, and also that could cause decomposition within deceased individuals. Temporary preservation pretty much means preservation long enough to get through a public visitation, public funeral, and a public burial. But the time that embalming lasts can be anywhere from days up to decades, but it is not a permanent state of being. Restoration means to restore a more natural, lifelike appearance within an individual. When people pass away, they tend not to look like themselves, so it's our job to make sure that they look as much like they did in life as possible. So let's begin. Before we actually begin injection of arterial solutions, what we do is we perform sanitary care, which is we clean all orifices and surfaces of the body with the disinfectant, and also bathe the entire body. At that point, we will set the features, which means to close the eyes, which we apply eye caps to promote a more rounded appearance of the eye. We close the mouth and we'll fill out if necessary. To fill out means to just place like a putty-like material inside of the mouth, which will, fill out the jaws a little bit, as they tend to sink in once a person has passed away. We will then position the body, which means to have the head tilted 15 degrees to the right, and also feet straight down, with hands crossed over top of each other, like so. Typically, if a person is married, it's left over right. Before we actually begin the arterial injection, once again, we'll gather all of the tools that we will need for our procedure. Go ahead and have all of that ready. We'll perform what's called a case analysis, where we will examine the entire body to decide what exact fluids that we will need. We have a great deal of fluids, as you can see here, that we can use for different cases that there may be. There may be bodies that have too much water inside of them, which is edema. There may be bodies that may be emaciated, which means that they've pretty much shrunken down to just a skeletal form. So we have all kinds of fluids that can replace or fix those certain elements. So then after that, we'll prepare our injection site, which means we'll make an incision along the clavicle on the right side. We'll use the scalpel like this, and the incision is usually about 2 inches long. So once we make the incision, we'll use what's called an aneurysm hook. And what we do with these hooks is we use them to pull away tissue and fascia that may be covering the right carotid artery and the right carotid vein. And then we will pull those vessels up and ligate them with string. This is a copy of the venous and arterial systems within the body, as you can see that. The blue is the venous system, which means that's where we get our drainage from. This is where the right jugular vein is found. This is the most typical vein that's used for drainage. This is where the right carotid artery is found. This is the most typical injection site for the arterial solution. And as you can see, it will circulate through the entire body and push blood out through the venous system. We also use other vessels that may be necessary if we're not getting distribution in a certain area of the body. So before we actually begin injection, we'll test the pressure of the machine and the rate of flow. We want the pressure and the rate of flow to simulate what a person's normal blood would be pumping through the system. Once we've tested the pressure and the rate of flow, we'll cut a small incision in the vein and the artery. These are the angular spring forceps. These actually go into the vein, and we will use these to promote drainage. It goes into about this point right here, and as we perform the injection, we'll use the end down here to help pull out clots that may block our distribution. A cannula is what goes into the artery. This is hooked up to the embalming machine and placed inside of the artery. And then these forceps hold the cannula in place during arterial injection. So we go ahead and begin arterial injection. Sometimes there's an immediate difference, sometimes there's not. Typically, the ratio goes a half a gallon to 1 gallon per 50 pounds of body weight within a human. Drainage should begin automatically, which means blood should start flowing out of the jugular vein that we have cut. What that means is we're getting distribution of fluid throughout other body parts. While we are performing injection, we are constantly observing and keeping an eye on all body parts to make sure that they are receiving distribution and they're not getting too much fluid. If an area is getting too much fluid, that means that there's a blockage. If it's not getting any fluid at all, that also means that there's a blockage. What you'll typically see is a change in the color of the skin, which will go to a more pink since we use dye in our arterial solution. Also, you'll see superficial veins or vessels on hands and feet, places like that. They'll start to dilate as if they had blood actually pumping through them. We massage areas to promote distribution and also keep an eye on our drainage and make sure we're constantly getting drainage. We will also manipulate, which means to move around body parts like legs and arms, and that's just to raise them above heart level and help promote distribution. After we finished our arterial injection, we'll perform what's called cavity embalming. Cavity embalming is when we use what's called a trocar. A trocar is this guy right here. He's inserted 2 inches to the left and 2 inches up from the belly button and is used to aspirate all body fluids out from the thoracic cavity, which is your chest cavity, your abdominal pelvic area, and those are the areas that are more prone to decomposition, so we go in and aspirate all of the fluids out of that, and we inject a very high index cavity fluid into that area, which will help prevent decomposition. After we have finished that process, we sew up all of our incisions, we bathe the body and wash the hair, and also brush the hair, make sure it's where it needs to be. We make sure that the body is once again positioned correctly before we leave. That's with the hands covered, with the feet straight down, head to the right 15 degrees, and we place what's called massage cream on the person's face. That will help retain moisture and keep their skin from dehydrating. So as you can see, embalming is a very complex process. I've just kind of went over the basics with you today, but it gives you an idea of behind the scenes kind of and how embalming actually goes and how it's meant to prevent, germs and things like that, and also to help promote temporary preservation for the actual funeral, and also to restore a person to a more natural, lifelike appearance. So I hope you guys have learned something. Let me know if you have any questions. Thanks.